So this time we'll turn it over to Dr. Foster and let her prepare us.
Thank you, Stan. I appreciate it. Happy New Year to everyone. I'm glad to be with you. I'm going to read today, as I welcome the new year along with you, from John O'Donoghue's book, To Bless the Space Between Us. It has a lot of blessings in it, and I had fun choosing which one I wanted to share with us today. This is for equilibrium. We hear a lot about resilience, but equilibrium is not a word we use often. Like the joy of the sea coming home to shore, may the relief of laughter rinse through your soul. As the wind loves to call things to dance, may your gravity be lightened by grace. Like the dignity of moonlight restoring the earth, may your thoughts incline with reverence and respect. As water takes whatever shape it is in, so free may you be about who you become. As silence smiles on the other side of what's said, may your sense of irony bring perspective. As time remains free of all that it frames, may your mind stay clear of all that it names. May your prayer of listening deepen enough to hear in the depths the laughter of God. Amen. Thank you all.
Amen. And thank you, Pam. I can't remember a message that didn't resonate in regards to allowing for us to clear our minds and to think about things in a way that sometimes in our many distractions of the world that we're in, we're not focused on doing. So thank you very much for getting us in the right spirit of embracing this information, but also being able to, be a little bit better than possibly we were before. So thank you very much. So we're going to transition and allow Natalie to give us an update on our employee cares and foundation initiatives. Natalie, you on?
Thanks so much, Stan. And hi, everyone. It's so good to see you guys this afternoon. And I just want to thank y'all for letting me come on the collaboration forum and give you an update on our Employees Care campaign. Next slide. So as we prepare for this year's campaign, last year we started using the Give Today for Their Tomorrows. That's something that us in the foundation, we use out in the community whenever we're talking to our community donors and our organizations and corporations and foundations that support us and our patient families all year. So we definitely wanted to continue that through to our employee donors as well. Next slide. And one thing too, that as we had looked at this past year and we had looked at and spoken with a lot of our employees across the system and especially our employees care champions, we really wanted to be able to focus our employees care campaign and shape our messaging to get to the point of what our employees want to see, which is what this is right here. Our employees do such an amazing job caring for our patient families, whether that's in clinical one-on-one care or behind the scenes each and every day. And whenever they give to Cook Children's, they want to make sure that their gift is helping those patients and families. So we just want to give them confidence in knowing that these additional things of generosity that they're doing outside of their job responsibilities by giving to employees care is really helping them throughout their entire medical journey. Next slide. So today what I'm going to do is I'm going to give you a little bit of a recap of last year's campaign for 2021, both in participation and in funding, and then we'll move forward and talk about this year's campaign. So with last year, obviously COVID hit us with a vengeance, and normally we do our in-person events throughout our February push, and last year we definitely took those all virtual. But one thing that we were very thrilled to see is that we still had a trend of very high participation numbers within our employee base. So you can see since 2017 where those numbers have hit. Now I will say the bar graphs, those show our actual employee donor counts, and then the percentages above are the percentages of our entire employee base and how many of those participated in employees care. It might look a little odd with 2019 and 2020 being 51% and 50%, but I will will say, as you move ahead, as you all know, our employee count has increased, and we have a lot more employees here at Cook Children's now. So that's why you see a little bit of that 5% and 10% drop in all employee participation. But whenever we made our announcement at the end of March, we had just over 3,800 employees that have made a gift to employees care. And I'm happy to say as well, and this also goes with the help of our new employee orientation team, sharing the message and the purpose of employees care, we've actually been able to increase that to 3,855 employees that donate currently, well, as of last week. So even though that percentage is a little lower than what it was at March, again, we've added more employees to our total employee count. So that's why that percentage dropped, but we have seen an increase in participation, which is wonderful. And on average, mostly we hit about 49% of all Cook Children's employees that give to employees care every year. Next slide. Now, I will say too, one thing that is always so amazing to me is the generous spirit of our employees. They're not only giving every day to the best of their abilities to their job responsibilities, but also giving from their hearts and giving from their pockets for employees care. So this past year in March, whenever we announced our pledge total, we did have a pledge total of just over $929,000, which was great. Again, like I said, with that hurdle of not having in-person events and not being able to be visible and share with employees directly face-to-face the impact that they make employees care, we are very excited to see this trend still stay stable at over that $900,000 mark. And as of last week, our actuals had dropped just slightly under 900,000, but still it's such a remarkable thing to see. And we have, as a collective over the past 22 years, raised nearly $11 million through this initiative. So again, such a great testament to our employees and their giving hearts and generosity. Next slide. So for this year, another thing we started last year and are continuing on is we really want to give employees that are current donors and potential donors an idea of the impact of what their donor dollars do whenever they give to employees care. So throughout the past 23 years, 53% of all donations have impacted that patient experience area. 18% has helped to provide equipment, whether that's to certain areas of the medical center or other off medical center campus offices, or to patient families to help them get through their day and through their medical journey. Also, 12% has gone towards family assistance. So whether that's clothing, got a little tongue twisted there, my apologies. But whether that's clothing or helping them through the hardships that they have while they're in our care, 12% has gone towards that. 10% has gone towards our community benefits. So of course, our focus on making our area a healthier place to raise a child. And then 7% of all those donations have gone to education and research. Next slide. Oh, and one thing I will say, I'm sorry, I forgot to mention from the previous slide, is that one thing that we will be doing and continue to do is we will send out monthly updates to all of our employee donors. So with those monthly updates, this will actually highlight a specific area or a specific item or program that has been funded through employees care and give them an impact story with that, as well to see what is going on in our community. So helping educate our employees about the foundation, that Cook Children's is a fundraising entity, and all of those wonderful partnerships and events that we have out in our community that also benefit us. Thank you. Next slide. So for our upcoming Employees Care 2022 campaign, as in previous years, we'll be promoting it all during the month of February. Now, with this year, again, we will not have in-person events. All of our interactions will be virtual. So where you can get all of the information, we will be sending out packets to all of our off medical center campus locations, as well as some of our different areas within the medical center. So you'll just receive information like the donation cards, the brochure, tent cards that you can put up in your break rooms to display during the month of February what's going on. And all of those that are off center campus, they will be delivered through courier, or we will mail them if the courier does not go to those areas, like the regional clinics and that type of thing. Now, just so you know, it's very easy to join, especially for all of you guys that are new to our system and new to Collaboration Forum. You can find all of the information you want to on our CookNet page on Employees Care. I will say that if you go to this page right now after this meeting, you will not be able to make a donation because our 2022 campaign does not start till February 1. You can definitely see information about the 2021 campaign and get more of an idea of Employees Care, but you won't be able to make your donation yet until February 1st. And then another thing that we implemented last year with the help of IT is we know that sometimes our employees, it's hard for them to get to a computer or log in with their user credentials and do some different work. So we were able to actually develop a site that employees could go to through their phones. So we have worked with them, and we will have QR codes on all of our materials so employees can easily scan that QR code and it'll direct them to the giving portal. Next slide. And as with previous years, it's really easy to sign up, and we have a very simple process to where you select the amount of your gift that you want to make as your donation, and then you also select how often you want to make it, and we do have 3 different options for that. We have a one-time donation, and this particular option, it requires you to sign up every year. So for those of you that are on the forum right now, if you made a one-time donation last year, it will not continue on to this year's. You actually have to go into this year's campaign and make your gift. That is the same with a per pay period gift for 1 year. If we do have employees that want to make a gift per pay period, but sometimes they just want it for that campaign year. So if they selected that option, they will also have to go in and sign up. But say if you want to make a per pay period donation and you just want it to continue year after year and not worry about signing up each year, you can select the ongoing function for that. And one special donation program that we have is our Our Kids program. So that's where a lot of our employees, they decide to donate an amount equal to 1 hour of their pay or more per pay period. And with that, they get an extra thank you gift, as well as invitations to special items that we have whenever we're able to do that out in the community again. Next slide. And this year, as within previous years, there are 2 specific areas that employees can decide for their donation to benefit. This year, we did make a slight change in the secondary option. The first option with Children's Fund, Our Greatest Need, that is an option that is there every single year. And through this area, that's where we support Child Study Center, various equipment and programs, expansion of care. A lot of our primary care offices are neighborhood clinics. And especially those of you that are directors of departments and you have a service line representative within the foundation, whenever you talk to them about those funding needs that you have, and if it's a good fit for employees' care and something we're able to do, this is the fund where we're actually able to fund those types of projects out of as well. And with our entire system really putting such a major focus on our patient experience, for this year's secondary program, we wanted to shift that giving to match that high concentration on our patient experience. So down below, you will just see a few of those areas that we've designated that fits within that patient experience area, whether it's camps for kids, our play areas, Laughter League, Try My Best Triathlon. Obviously, we do have some different departments that put on special activities for our patients that's being funded by donor funds. And this is something that's been supported by Employees Care in the past. Spiritual care, as well as emergency housing and living expenses. So whenever employees go on, they select the amount they want to give, they select how often they want to give, and what area they want their donation to benefit. Next slide. And as with every year, people always want those t-shirts, and we love our Employees Care t-shirts. And again, with this year, we had everyone vote. We posted on CookNet, so thank you with internal communications for helping us with that. But we wanted to post for voting for people to vote on the t-shirt. So this is the winner, and this will be the t-shirt this year. And in that same vein, we also asked our Kids gifts. We gave them a few different options and had them select what gift they would like to see. And so our Kids selected a blanket that rolls up. So these are the 2 gifts you will receive for your donations this year. Next slide. Now, one thing too that I really wanted to take a moment to concentrate on was our Employees Care Champion program. So with our employees care champions, we actually have quite a few where they are the advocates for employees care within their departments. They're the people that team members know that if I want information or need information about employees care, I'm going to go to this person. Also to this person, make sure to share the information. And they're also our contact when we're doing gift distribution to make sure that we give them the t-shirts and we know that they'll get to the employees if we weren't able to hand them out personally. Now, in a few minutes, I'll share with you who our current champions are, but we would love for all of you that are on this call today to really look at your team and solicit your team members to be a champion for employees care to help promote this cause within your department. And then another thing that we have added this year for our champions and for those certain areas, we will follow up with some guidelines and processes, but we are going to be working with our champions and allowing them to work with their directors in their areas and submit some funding needs for us through employees care that we'll be able to fund. So much like the foundation works with other service lines for one-on-one for our large ask that we do, we'll also be doing this with our champions as well. And I'll follow up at the end of January and give guidelines to our champions as well as those directors of those departments. And then here is a list on the left-hand side on the 2022. These are our current champions that we have throughout the medical center, as well as primary care offices and other offices across our entire system. Now, this was submitted last week, so some of these people may have confirmed on the ones that you see previous champions pending 2022 confirmation. These are the folks that have been champions for us in previous years, and we're just waiting to see if they want to do it again this year. But I wanted to present this to you so you could actually look, see if your area is represented, and then if it's not represented, definitely reach out to us. Next slide. And for this, again, employees care, how you can help. Just champion the cause of employees care, direct your team members to CookNet for more information. We'll also be mailing out a postcard to them as well. For that champion designation, we would love for you to designate a champion of your area. And if you could do that by January 26th and just email the employees care link there, that would be wonderful. But most important, obviously, we want you to know that your gifts and your generosity, they truly do make a difference to our patients and our families. I know when we talk to some of our patient ambassadors and we explain to them what our employees do and how they give back, it just brings them to tears, and they are so grateful for the additional steps that all of you take to make sure they're taken care of. So thank you so much. And then these are just a couple of quick questions people usually have. Deductions, whenever you go onto the employees care portal, those deductions come out of your paycheck. Yes, people can donate cash or check. They just fill out the card, or they can contact us and we can send that to them. For this next campaign, deductions will start in the first pay period of March. And then as always, people can always email employees care and we will answer them promptly. But then on the last slide, I also wanted to make sure you had my information. So our employees care generic email is there, my information, obviously, and then Clara Martin is one of our employees in the foundation that is also our coordinator for employees care. So she will be happy to help you as well. But again, I just want to say thank you. Every year, this is one of my favorite programs, and I'm just amazed by the giving hearts that all of our employees have. And I also appreciate each of you and your support and sharing this information with your teams.
Thank you, Natalie. Thank you very much for that very much impactful, important information. As everybody knows or should know, giving is one of our values, and this is a great opportunity for our team to give back to the organization and promote amazing programs that are needed throughout our organization. Natalie, one suggestion that came into me in regards to this, it may be a good idea to do a video or at least photos of each of the employee care donation areas so that employees can see where their gifts are going. So maybe that's something that you can think about and see how we can do that. So folks to see where their dollars and their impact is going to help, us enhance our promise throughout the organization. So think about that.
Great, thank you.
All right, so we'll transition now to Lee. Lee is going to give us a financial update.
Hi, good afternoon, everybody. Just a quick financial update for how the medical center is doing through the first quarter of fiscal 2022. Next slide, please. Next slide, please. There we go. Okay, so as we built our budget last year, which occurred mainly in May, June timeframe, started really to peak again until the summer surge happened around July, August. So we were a little, we felt like we were being a little bit aggressive with our budget, but it turns out that we came in pretty close to what we budgeted so far this year through the first quarter. The difference being that it's been a little bit more flat from month to month versus kind of a slow start and then starting to spike in December and January. Although there were increases, the increases were less severe than what they have been in the past. But nonetheless, the numbers are very close to what we had budgeted for the year for admissions and observations, and I think you'll see that trend as we go through the next few slides. Next slide, please. On inpatient days, acuity and length of stay have increased a bit. So we didn't budget as high as what we've accomplished from an inpatient day standpoint for the first 3 months of 2022. But so far it's kind of held at least at budget or a little bit above for most of these 3 months. Next slide. And that is largely attributable to the specialty care days increasing quite a bit. Those days were a little bit suppressed in 2021 and prior or after the pandemic hit in 2020. So we didn't budget very high for those, but the first quarter of 2022 has certainly shown that those days are coming back to pre-pandemic levels. And next slide. And then our front door to the hospital is largely the ED and UCC. And so those numbers are typically correlate directly with our patient days and admissions and observations. So as you can see, those numbers have increased quite a bit from where we were in 21 and have even surpassed what we thought was an aggressive budget for 2022, but apparently not aggressive enough on the budget side. So pleased to see those numbers being above what we targeted. And then lastly, the surgery numbers. Surgeries was an area where the pandemic didn't impact us quite as much as all the other areas. So these graphs look a little bit flatter, but we have been able to achieve our budgeted targets so far this year, and almost to the pre-pandemic 2020 levels at this point. So that's just a real quick presentation on what's going on so far in 2022, and moving into the second quarter of the year. Hopefully all these metrics continue to be at or above budget. I think that's about it. Thank you.
All right, Lee, thank you. As everyone can see, the volumes are returning to some of the pre-pandemic levels. Unfortunately, we've been challenged with staffing, and we'll hear a little bit about that when we hear a COVID update. But we know that everybody is extremely tired and busy, especially those of you who are at the bedside or supporting the bedside, and all of us in general. And we just wanted to make you aware that we appreciate all of your efforts, and we're doing everything that we can to support you. So thank you all. And the numbers that Lee just reflected tell us what we already know, that we're very busy, and we appreciate all of your hard work and efforts. This time we'll transition to Doreen, and she's going to give us an update on Joint Commission.
Can everyone hear me okay? Okay. Hello, everyone, and Happy New Year. So here we are, 2022, and we're still waiting for Joint Commission. And I know what you're thinking, will they be here? Are they coming this week? Did they forget us? And they will be here. We just don't know when. So our survey is still scheduled to happen sometime this year, as far as we know. And the Joint Commission survey will always be unannounced. So I will not know until they actually show up. So I appreciate your patience and hanging in there and continuing to do everything you can to keep us ready. Next slide. So as part of getting ready for survey and watching and waiting, I contact the Joint Commission every 2 weeks, and I look for numbers to see that the Joint Commission has on all the counties, and to watch for COVID numbers. So as you can see, as of the 9th, our rate for COVID was 12.23, and the trend was 4.75. And for them to come at a fully vaccinated team, our numbers have to be anywhere between 6.5 to 7 for that rate, and that's the number of new cases per 1,000 residents. And the trend needs to be less than 1. And as everyone knows, we skyrocketed. So right now we are very high, and it's very unlikely they would show. But I want you to be aware, if you look at February of 2021, you could see we were 12.24. And we slowly, right after that, started to creep down, which is wonderful. So I don't want you to let your guard down. This will be up and down. I think, I don't know for how long, but we just have to keep ready and keep doing what's right to give good, safe care. So now that we know that they're going to come most likely sometime this year, now what type of survey will we have? Our on-site survey is traditionally what we've always had, and that's when the survey team shows up unannounced and we have a survey. Virtual survey is on hold, and that's per CMS. They have not done any since early last year. And the reason for that is because CMS really doesn't care for that process, and they require Joint Commission to validate within 6 months. So they're having the same staffing issues as we are, so that makes double work for them and as well for the organization. So right now, there's no mention at all of a virtual survey, but they have started to do some hybrid surveys, and that's a combination of some virtual and some on-site teams. Next slide. So a hybrid survey. So on November 29th, I received notification from the Joint Commission that we meet the eligibility criteria for a hybrid survey. So I submitted some information in a survey and sent that to them, and I'm still waiting to hear whether or not we'll have a hybrid or not. So the big difference with the hybrid survey would be we only will have one surveyor doing a hybrid survey. So we'll have to quickly get notification. We will upload a bunch of documents, and then I'll continue to watch the site, and 6 surveyors will arrive instead of 7. So right now we're scheduled for a survey team of 7. They'll be total, and then they'll be here for 4 days. So if we have a hybrid, we'll have 1 surveyor that will look at our documents remotely, do some closed medical record reviews, and then we'll have 6 of them here. So so you all will not even feel the impact. It will feel like the regular survey that we always have. Those that have to produce documents and upload, we've been practicing and encouraging to scan and have ready. So when we have this notification, it'll just be a short time before we have to upload and they come, because they know once they notify us and we upload documents that the word is out in the hospital that they're going to show up any day. So if I receive that notification, you better believe I will let y'all know too, to give you a heads up to be really prepared. So next slide. So this is just a quick glance on the 2 different that we are eligible for. Again, I do not know what fashion this will occur in, but the on-site traditional survey, I watched their database, will be notified that morning by 7:30, and the survey team will be there. The hybrid, I'll receive an email or a phone call from Joint Commission to upload documents shortly after that on our website. We'll have notification that a team of 6 will arrive. So again, we're in this holding pattern. We just need to be ready for anything with COVID, with our numbers up and down. And I know that's really hard for all of us. And it's just, it's out of our hands. So we just need to keep ready and keep doing what we're doing. So how to keep ready and to remember to do some things on your unit to ensure a good survey. So keep your unit always clean and organized. Remove expired items. Some ongoing things that were seen in the community and also here, and I included the policy so you can go back and reference breast milk, make sure it's labeled and stored correctly. Information for use, IFU, that's huge this year with Joint Commission. So make sure all of your equipment, all the instructions that you can find those manufacturer's recommendation that you're cleaning and caring for the equipment as recommended. High level disinfection. Where we struggle with is having the instruments wet and remain wet from after use until it goes to sterilization. So just be aware of that. PPE, make sure gowns are closed in the back. Make sure people are wearing eye goggles too when appropriate. We're seeing a little bit of drift from that time to time. Site marking a timeout, that's always a hot topic. So review, that applies to your area review policy PS 573. Next slide. Care plans, keep up to date, pain assessment, reassessment. I know you all are doing it, but if it's not documented, it's not done. So make sure that everything that you do is documented. And pain medication, make sure that we're medicating appropriately. If they're having mild pain, that we're doing an intervention for mild, and the same for moderate and severe. Restraint seclusion is always a hot topic for Joint Commission. So make sure we're following our policy, have orders, we're monitoring the patient and providing safe care for them. And moderate sedation as well, that's another hot topic too. And we do a good job of looking at that, but make sure that we are doing those vital signs in the frequency that our policy says, that we have consents for procedures when indicated for the sedation, and that we're documenting everything that we do. Make sure your department HR your department HR files are up to date. We don't know what employee files will be selected. So now that we're in this holding pattern, be a good opportunity to look through that, make sure they're ready and up to date, that we have a good license in there, that PACE evaluations are done on time so we can pull this information and provide it quickly. If we have any equipment in our unit, make sure those little stickers, the PM preventive maintenance, are up to date. If they're not, help Biomed out and give them a call. You can email them or give them a call and they will be up there quickly. I can guarantee it, to help you. Do not store anything in front of fire equipment, meaning fire safety, fire extinguishers, emergency oxygen shutoff, pull stations. I mean, we have so much going on. We have things on wheels. It's so easy to roll something in the hallway, and before you know it, it is in front of a piece of equipment that should not be blocked. And the same with our fire exit doors. All of that cannot be blocked. Next slide. Make sure eye wash station logs are checked weekly. And then most importantly, make sure the path to an eye wash station is never obstructed. The last thing you want for your employee is to have something in their eye where they have to wash that out and they can't see and they have things to go through. So that always needs to be clear. Crash carts, make sure they're checked weekly, that we do good handoff communication. And then I want to talk a little bit about telephone order and verbal order readback. We're seeing a little bit of increase of verbal order readback, and I think people are using them interchangeably, and they really are two different things. So the Joint Commission says we can use both, but verbal orders should be used for rare situations, emergency. We shouldn't do a verbal order readback if someone is there telling us an order unless it's emergency situation. Telephone order readback is okay to do because you're not always going to have a provider there to give you an order. So it's okay to call them on a cell phone, a landline, or use voice or a page. So when we're doing those two different things, make sure we're doing the telephone order readback or verbal order readback. And I included the two policies that speak to that. Oxygen storage, full and partial and empty, make sure that they have appropriate signage on that and we are storing them correctly. And then the last thing, work orders. I include information on how to put a work order in. That's another big thing with Joint Commission. So it's not just the seal and tile stain that pops out and replaced. They want to see what caused that. So they will look for work orders to see if the cause for the leak, if needed, was taken care of. Are there trends or every other week and 5 main, are we replacing a seal and tile? They're looking for things like that, that we are taking care of the situation, not just changing something and making it cosmetically better. So those are some, I guess, hot topics in the community. And then also what we're seeing here a little bit too, that we can do to, as we're in this holding pattern, to keep everything ready and for Joint Commission survey. So it will really happen. I wish I could tell you when, but all I know is that it will happen either hybrid or a traditional on-site survey. Thank you all.
Okay, Doreen, I thought they had forgotten about us. I guess not, huh?
I know. Real luck. No.
So everybody, please receive this information. And it's what everything else we've talked about today. Look at how it applies to your area. Share it with your staff. Survey your areas. Make sure in this case we're in compliance. If you have any questions, Doreen is a great resource. But we also have other resources around the organizations for those specifics also. Something that's very important to us, it's our deemed status for our CMS accreditation. Joint Commission serves that purpose, and that allows for us to be eligible for government funding, which is a huge part of how we take care of things around here. So it's a big thing. So let's make sure that we're ready and we exceed all of the expectations. Last but not least, it is Dr. Whitworth, and I hope she's on. She was busy a little earlier. She's going to give us a COVID update, and there she is. Hey, Dr. Whitworth. She's going to give us a COVID update and hopefully answer maybe questions that you have or give clarification to things that you were wondering about. Dr. Whitworth, you have it.
I want to kind of give you all the state of the union for COVID cases and talk to you about what we can do about it. So I pulled this graph from the CDC website this morning. We are seeing nationally about 750,000 cases of COVID disease a day as a nation. Last week, it was 500,000 a day. The week before that, it was 350,000 a day. So when you look on the far right side of this graph, that is not the closing of the box on the outside of the graph. That's the tall vertical blue line on the far right that goes up to 1.4 million cases reported yesterday. And just to give you a feel, that last winter we had our surge, that's that little bump in January in the middle of the graph. And then Delta surge for number of new cases nationally is around September. So you can see that as far as the number of new cases, it's phenomenally more than it has been with any other surge nationally. Next slide. There's a lot of talk about how much of this is resulting in hospitalization or not. So this is the same graph I just showed you, but on top we are adding hospitalizations with the yellow line. And of course, these numbers are much lower than the case number. You can see that the hospitalizations in the January surge a year ago peaked out at about 17,000 hospitalizations or new admissions per day. The total number was a little bit lower in the Delta wave, although for us it was worse. And then when you look at now, the number of hospitalizations nationally, we are more than we've ever been before at about 20,000 hospitalizations and 20,000 admissions per day. Next slide. And then when you just look at our own community here in Tarrant County, the lower left bar graph shows you the number of new cases in Tarrant County each week. Each bar is a week. And that very tall line over to the right is not an error. That's the number of new cases of COVID that were documented in Tarrant County last week, significantly more in 1 week than we've ever had in 1 week before. Next slide. This is looking at hospital beds, and the disease has gone up exponentially, and the hospitalizations have not gone up exponentially, but they are rising, with the thought that Omicron may not be as pathogenic or severe and may not lead to as many hospitalizations. That we still know nationally there are more hospitalizations for COVID than there were in Delta, but maybe not as many as you would expect there to be. I think that's a good way to put that. So when you look at this graph, go ahead and go to the next slide. It tells you that at the current time, there are 1,182 people in a bed in Tarrant County hospitals that have COVID infection. Friday, it was 940. Monday, it was about 1,090. And this is, as of yesterday afternoon, it was 1,182. So the hospitalizations are on the rise with the Omicron variant. Scientifically, there is a lot of argument about whether Omicron is milder or not. And it's not clear. Some people think that in the wave of Omicron, it's possible that our most vulnerable patients have died already from COVID if they were going to. And those of us that are left, the population that's left is more vaccinated and has already survived this long. And it's hard to really put your finger on that and wrap your arms around that. It's not clear that this is less severe, but maybe it's less severe. We do know that we're still full of COVID here and still dealing with it, especially with staff shortages because all of us are getting sick too. And so let's go to the next slide. Here is what we are looking at here at Cook. Again, this looks exactly like the CDC graph. If you look over there to the right, you can see that the number of positive cases within the full inpatient outpatient system here was up to about 700 cases per day. More positive tests, more percent positivity than we had in either of the other two waves. Next slide. So the question is, how are we ever going to get through all of this? And I want to give you all some of the positive things to know about this. Our toolbox is really very different than it was a year ago. As a system, we are much more likely to be vaccinated, which is helping to keep us safer. We know that these vaccines are very effective at decreasing your risk of landing in the hospital and death, even though a lot of us are going to get a mild infection. Remember that when you have a vaccine, one thing you can ask the vaccine to do is prevent any case of illness. For things like polio, that is paramount and critically important. When you have an illness that can have a milder presentation and you have vaccines for that, we are now asking, is the most important thing that the vaccines prevent every single infection? Or is it the most important thing that the vaccines keep us from getting sick enough to land in the hospital or die? So we know that the vaccines are excellent at keeping us out of the hospital and keeping us from dying of COVID. We know that in the children in our hospital here, very rarely is there a hospitalized patient sick with COVID disease who's fully vaccinated. That's very rare. That is borne out all over the entire nation. The vaccinated people are very unlikely to be hospitalized, but the vaccine does not fully prevent just the infection. Just the mild infection can happen as well. We hope to avoid that because if you get the mild infection, you still have to be out of work for 5 days and you can still hug a relative that's on chemotherapy who may not do very well with this. The next question is, how will we get through this with our outpatients? There are a ton more tools in our toolbox to keep our outpatients from having to be admitted to the hospital and to keep them from dying. We know that sotrovimab is one of the monoclonal antibodies available. It's the only one that neutralizes or kills the Omicron variant. So for outpatients at high risk of progression to severe disease, we're trying to give them this monoclonal sotrovimab. The problem is we don't have any, and neither does the State Infusion Center. And for that matter, not very many other people in the country. It's in terribly short supply. A second option for outpatients to help keep them out of the hospital that's brand new in the last month is Paxlovid. Paxlovid is the oral antiviral medication taken twice a day for 5 days. When you look at the scientific data, the monoclonal antibody infusion is about as effective, about equal to children who get Paxlovid as far as preventing hospitalization. The same is true for Paxlovid. There is not very much of it nationally to be found. We are getting a few doses here, hopefully later this week. The Paxlovid is only used for ages 12 years and older. A third option is molnupiravir, but this is only for ages 18 and over, so we probably won't be using as much of that here for our outpatients to keep them out of the hospital. A final option that's not very appealing is to give people remdesivir as an outpatient if they're 12 years of age and over. We are bound by EUA rules on all of these things. Remdesivir can be given once a day through an IV to an outpatient for 3 days in a row to help prevent them from having to go to the hospital. We have not done that for our outpatients yet because logistically it is very different. It's very difficult to put an IV in 3 days in a row and to have a place to bring them back to when they have active COVID infection. Next slide. What are we doing about our inpatients? We know that all of these treatments listed here are beneficial to help our inpatients stay out of the ICU and to help prevent death. Dexamethasone decreases the inflammation in their lungs. Remdesivir, when used for these patients, kills the virus directly. Tocilizumab is a third drug that we're using that gives us much stronger immune suppression to decrease inflammation in those who have a really excessive inflammatory response. Those are the things that we are using on a regular basis here. We have so much more at our disposal now than we did a year ago to help keep kids healthier, and we're using everything that's listed here. Some of the other things we use are Lovenox. People who have COVID infection are prone to getting blood clots just from the virus infection itself. Much higher incidence of stroke and blood clots in adults particularly, but also teenagers. So we put people on Lovenox when they get here if they're at risk for a clot. We're also using IVIG and anakinra for children who develop the inflammatory syndrome. And these two drugs have been remarkable in really making kids feel better within about 24 hours. That is the information that I wanted to give you all. Stan, do you want me to go through the chat and answer questions, or do you want to do that?
No, I was going to actually thank you for recognizing that. There's a couple of questions and we have a few minutes. If you could respond to them if it's appropriate.
There are questions about a lot of false negative tests with Omicron. Is that true? The formal answer is that rapid tests that are listed as an approved test by the FDA for emergency use should pick up Omicron the same that they did with Delta. Our lab here, our PCR lab here, will pick up Omicron the same as it did with Delta. At saying that to you, I hear what you're hearing. I have had lots of friends that are negative, and then positive on these at-home rapid tests. And I don't know what to tell you about that. I know that the ones we're using for our system here are approved and should be able to pick up Omicron in the studies that have been done so far.
Okay.
And then, is there any tracking of hospitalizations due to COVID versus hospitalizations for other reasons and incidentally COVID positive because every admission is getting tested? For sure, that is a great question to ask. And what you're saying is, how many people are in the hospital with COVID versus how many people are in the hospital for COVID infection? I do not have the answer for you for the number of kids that are here. I just counted. We have in the mid-50s of children in the hospital here that have a positive COVID test. And I do not know what percentage of those are with COVID versus for COVID. I can tell you there are plenty of children here with a positive COVID test who have something else. The thing that is important to remember about that is we have to keep the staff safe from getting COVID from the incidentally admitted children who are here with COVID. That still leaves us with all of the infection prevention for the staff here. Let's see, the next question. I think that's it.
Now there's one about, will we have to get vaccinated again this year?
Oh, I'm sorry, I missed that. Yes, I don't know if we're going to have to get vaccinated again this year, and I don't know if it's an annual shot. It's important to remember that with influenza, we get an annual shot because there is genomic drift and shift with that particular virus, and it has to be a new shot every year. So far, the vaccines that we have gotten have worked for Alpha, Beta, Delta, Omicron. They're not as effective for Omicron, but if you get a vaccine booster, you're well protected to stay out of the hospital with Omicron. So the jury is out about when or if the next shot will be.
Outstanding. And there's a lot of great comments about your presentation, Dr. Whitworth, about how easy it is to understand. And even one says they wish you could present to the whole nation, the whole nation could hear you. One comment that you rock, and we agree, you're very gifted. And Amanda writes a comment, she thanks you, but she also asks for everybody to have patience as they're using the drive-through. She's thanking everybody for using the drive-through. But as you've seen from the numbers, we're very busy, and we encourage you, if you're coming in with your child for pre-op procedure, or if you're coming in to be tested, that you have a little patience with the drive-through team. Couple of announcements. Beth wanted to make everybody aware And we should all celebrate this. Suzanne Sider has been promoted to the Director of Talent Acquisitions. Woohoo, Suzanne, well deserved. She has been with us for a while, don't know how many years, but she's not new to the organization, but she's recently been promoted. And we also have a semi-retirement. So I'm gonna call Beth after this and see what semi-retirement is. Maybe that's something we all need to know about. But Lori Goosen is going to halftime status. She's going to be in a halftime role with her primary duties being to recruit and acquire talent for the Prosper Hospital, which is very important for us this time. You know, we used to talk about Prosper like it's a year from now or 2 years from now. It is actually this year. So Lori's going to be helping us to get that place staffed. And we also have a new occupational health physician. His name is Dr. Thomas Kevin Nelson. I believe he goes by Thomas, but we would like to welcome Dr. Nelson to the Cook Children's family. If you're on here, or if you see him or if you interact with him, please welcome him to our team. A couple other things. We got a bunch of sports fans out there. You guys know the Cowboys are playing this weekend, right? Let's cheer them on. Even if you're not a Cowboy fan, let's cheer them on. It's playoffs. And on Friday and Saturday, we've been told that you can wear your favorite jersey, shirt, hat, or socks to reflect your support for the Cowboys or whatever team that you're supporting during that time period. And we had got an announcement from the lab about a week or so ago that there's an anticipated community blood shortage that we're concerned about. And Carter Blood Care has put this information out. So we're encouraging everyone, if you're eligible, to donate blood so that we can make sure we have ample supply in our community. And there's a question from someone about why we're not doing the gift cards anymore. If you recall, I used to ask questions, and if someone answer the question, or the first person who answered the question was eligible for a Cook Children's gift card. So by popular demand, next month, we'll be doing the gift cards again. So get ready. And that was just to make sure that we're listening and we were getting the great information that these presenters presented today and others, and we're sharing that with our staff. So there's probably a few other chat items. We're coming up on 2 o'clock. We'll answer those and get back with you through the chat section, and we'll go from there. Thank you all, the presenters, Dr. Whitworth, Doreen, Lee, Natalie, Dr. Foster for giving an invocation, and all of the folks who put this together. Jeff Calloway, Laura Van Hoosier, Lori Hensel, the IT team, everybody, thank you all. Our next collaboration forum will be next month. And I think that slide was going to pop up, but since it did, it's February 17th at 1 o'clock will be our next our next collaboration forum in February. We've got a couple of topics, but if you have something that you'd like to present, and this goes out to home health or CCPN or the health plan, as well as the medical center, all of our entities, our system entities, if there's anything, please let Lori Hensel know, and we'll see if we can get you on the agenda. Thank you all for your time. Share the information and be safe.